We're joined now by the Chief Medical Officer at Henry Ford West Bloomfield Hospital. Once again, Dr. Manu Malhotra with us on the program. Dr. Malhotra, thank you for being with us.
Thanks for having me. How are you doing?
Appreciate having you on. We're doing well. How are you? How's your team over at Henry Ford West Bloomfield?
Doing very well. I think things are stable, and we have learned a lot over the course of the last several months. So we feel that we're in a good position to make sure that we're keeping our community safe and healthy.
The COVID-19 response obviously had taken a toll on hospital workers, had taken a toll on hospital operations. Now that we're back in some semblance of normalcy, some regular operations have returned, and we talked about this before with President Wallace from Henry Ford West Bloomfield Hospital. How are things now at the hospital as they're starting to return to normal? Are we seeing more of the normal medical cases come back to the hospital, or are some of those still on hold as the pandemic continues?
No, we are fully operational, and all procedures, all clinic visits, all testing is operational. So we are, by and large, operating more or less as we were prior to the start of the pandemic. So there is, at this time, no limitation to the services that we're offering, and no reason to hold off any services that people need. One of the things that hasn't gotten enough airtime probably is this concept that over the several months of the high COVID infections, very important, critical, and basic health care got somewhat neglected. People were so afraid to come to the hospital that even for things like strokes and heart attacks, they didn't come to the hospital. And that's really not something that we can have. So we want to make sure that people are aware that their usual and other health needs still need to be addressed, regardless of what happens with COVID-19.
How is the hospital prepared as far as supplies such as PPE if we have a second surge in the fall?
We are well prepared for that. To be honest, this hospital never ran out of PPE at any time. Unfortunately, there are clearly some hospitals and hospital systems that were not so lucky. We were fairly well stocked to start out with. From what we've learned by the increased burn rate the first time around, we've increased our par levels, so we're holding even higher amounts in stockpiles. So I think everybody's learned from this experience. We weathered the first spike pretty well from a perspective of personal protective equipment, and we anticipate that if there is a second one, that we are in very good shape to be able to deal with that.
Dr. Manu Malhotra with us. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital. Dr. Malhotra, Henry Ford is now involved in a vaccine trial, phase 3 vaccine trial, in a partnership with Moderna and their COVID-19 vaccine. Are any of that operations being done out of Henry Ford West Bloomfield Hospital, or if people are interested in getting involved with that, are there any first steps that they can take through Henry Ford West Bloomfield that you're aware of?
So the current recruitment for that is happening through Henry Ford in Detroit. However, we are just opening conversations about starting to recruit on this campus as well. So even though that is not currently happening, that may happen over the course of the next several weeks. But in the current environment, it is the recruitment is happening out of Detroit. There are online forms that we can provide for you, the online links where you can get the initial screening completed and then sign up for eligibility. So that can be done online.
Can you talk a little bit about the collaboration within the medical community to try to combat this virus?
Yeah, I think this is really, a common enemy, and really we need all of the different components of the healthcare spectrum to work together to make sure that we're keeping the communities safe at large. So we spent a lot of time over the first several weeks to months of this pandemic actually improving and building interfaces with the rest of the healthcare community, where maybe we hadn't been doing it as much previously. So one of the first things that we did at Henry Ford West Bloomfield was actually connect with our local skilled nursing facilities and start a daily dialogue about what the situation on the ground is here at the hospital and at the nursing facilities, so that we could make sure that there was no lack of communication when patients are being transferred, which inevitably they would be, so that we know what everybody's PPE, personal protective equipment situation is, to make sure that everybody's using the same protocols and that there's full transparency when we do run into any problems. So I think that has been a very fundamental, actually positive as we move through this. At least in this community, we had a lot of very positive collaboration with physicians in the community, with skilled nursing facilities and rehabilitation facilities, with first responders, and really anybody on the healthcare spectrum.
Dr. Manu Malhotra with us. He is the Chief Medical Officer at Henry Ford West Bloomfield Hospital. Dr. Malhotra, in the recent weeks we've seen that particularly COVID-19 testing has seen delays in results coming back from the labs. From the hospital's perspective, as you're treating patients who are potentially COVID-19 positive and have been tested by the hospital, or other patients as well that you're testing in an abundance of caution, is there any priority in terms of which of these tests need to be back as soon as possible, and any way to work with those labs that Henry Ford is collaborating with on their testing to ensure that these patients are at the front of the line and their results that may be more timely are not delayed?
So Henry Ford Hospital does all of its testing internally, at least for our active patients. So if there's more of a public screening, that is where we may have some send-outs. But for any patients getting care within the Henry Ford Health System, we do all of our testing, and all of it turns around within 24 hours. The vast majority of it within 12 hours, and most of them even much earlier than that. So we're dealing with real-time information in those cases, and we don't have to appeal to anybody else to help us with that.
Dr. Malhotra, that is good news to hear from you, that patients at Henry Ford West Bloomfield Hospital and others in the Henry Ford Health System will not have to wait for those delays that have been affecting a lot of other people throughout the state of Michigan. So going forward, as we continue through this pandemic and as some sort of normalcy returns, what is the hospital, what is your team doing to continue to stay vigilant and prepared in the case that there is another spike, or that there is a second wave later on?
Right. So I think we're all proceeding as if it is very, very possible that we will have a significant second wave, second spike. However, that doesn't mean that we, stop business as usual. I mean, we need to be in the business of providing care for patients that is well outside of the COVID-19 response. So primary care, ongoing health maintenance, elective surgeries, and things that are tests, screenings, all of those things are still necessary, and we're going to continue to do those. We're going to do them in a way that is slightly different. You'll see that everybody in the hospital is wearing a mask. That's required. I think there's been a lot of conversation around masks, and frankly, some of it is a bit unnecessary. We know that masks decrease the risk of transmission, and in the current milieu, we should all be wearing one anytime that we are at risk of exposing anybody else. That's indoor, unable to social distance. Clearly, anytime we're in groups that are any larger than a few people. So, very strongly putting in a word for wearing masks. That's what's going to keep Michigan ahead of the pack. I mean, we've been doing very well so far. We did have a bit of a ramp up in cases more recently. However, we're not seeing a very steep increase. And I'd like to say that if we continue with the social distancing, the mask wearing, and the commitment that the state of Michigan and the people here have made to keeping each other safe, that we may come out of this without any significant second spike. However, we have to be prepared for it. So whether it is the vast abundance of you know, disinfectants that you see, the frequency of cleaning that's changed, the fact that we are minimizing non-essential traffic through the hospitals, controlling, the ins and outs and touch points. Those are all the things that we've altered to minimize any risk. But we have to also accept that we no longer live in a risk-free environment from that perspective. And there are no risk-free alternatives, just commitments to making every interaction that we do minimizing the risk in those situations. And clearly that's a question everybody has to ask themselves as we talk about moving into schools in the fall and all that also.
This, this pandemic has sparked a political firestorm, especially around possible treatments. What do you want the public to know about the science of this virus and how to cut through the politics to be well informed and knowledgeable so that we don't continue the spread?
Yeah, I think it's a tough question, specifically with regards to how do we make sure that we're all consuming the correct information and doing a good job of really sidelining the information that is not validated. So I think the first thing to know is that we are getting better at treating this. So we do have an abundance of research coming in that suggests that steroids work, that suggests that remdesivir antiviral works. So one of the components in the decrease in the mortality rate from this probably is that we're getting better at it. We've learned a lot over the course of the last several months. But the reality of it is, and the reality of science is, that this information is continually being improved upon as we learn more. So I think the first thing to realize is in science that we should be humble about the fact that we don't know everything and that we will continue to learn and adapt to the new information that comes in. So I think any conversation around, oh, look, they said that, and then they changed their mind, so that nullifies the fact that this was a scientifically relevant information, I think is the wrong way to look at that. So I think that we should be always hungry to get more information and make sure that it's validated by legitimate studies. Unfortunately, there are plenty of people out there with seemingly appropriate credentials touting what sounds like research, and a lot of it's complete hogwash. So I really feel for the average person in the public that wants to be an informed consumer of this information, and the difficulty that they're having with this information coming through such a polarized and political view. I think there should be nothing political about keeping people safe. There shouldn't be anything political about masks, and there certainly shouldn't be anything political about which treatments work and which don't. So to the extent that we're able to all work together, I think we'll have a lot of success. I think the fast tracking of the Moderna vaccine testing is a good example of people working together to find solutions. This is a very fast-tracked process to get to phase 3, and all indications are that we're not cutting any corners on safety. And what we've done is, in collaboration with the government, cut a lot of red tape and save ourselves time that way. So hopefully we'll have something positive to report on that.
Dr. Malhotra, anything else for us today before we let you go? Anything else important for our audience to know that you'd like to discuss?
I think I did touch on this. Please do not defer the healthcare needs that you have, whether these are health maintenance, screening, elective, or urgent issues. Emergency departments, hospitals are safe to go to. We are taking every precaution, and there really aren't reports of any spread at the hospitals anymore. So, as we've learned more about this, the hospitals may be the most focused on making sure that there is no spread. So please do make sure that people are aware that they need to follow up and get the care that they need. I think that's number one. Make sure that people are wearing masks. That is an essential component of keeping these cases under control in the short run. And then, the other big thing is, these are high stress environments. So please be kind to each other.
Well, Dr. Malhotra, thank you very much for being with us today.
Thank you.
Appreciate it. Dr. Manu Malhotra with us from the Henry Ford West Bloomfield Hospital. He is their chief medical officer.